While the numbers of the new COVID-19 seem to be easing, experts say that a fourth wave of COVID-19 infections is set to hit the country soon. To talk to us about the impending fourth wave of infections in the upcoming local government elections, we're now joined by epidemiologist Dr Jo Barnes from the Stellenbosch University. Dr. Barnes, always a pleasure to see you. Thank you so very much for joining us here on SABC News.
Good afternoon to you and to the viewers.
Doctor, with the number of COVID-19 infections showing a decline, should we expect the country to then, relax lockdown regulations? Are you expecting, and should indeed the president then relax those restrictions from level 3?
This is a really dreadful position for the president to be in, because we have, on the one hand, the health situation calling for the utmost restraint, if you can possibly call it like that. And then on the other hand, South Africa is suffering dreadfully economically and otherwise. So this is the first wave that we have seen that doesn't coincide in all of the places. There's still increases in KwaZulu-Natal. It's coming down very nicely in the Western Province, but the Western Cape, but we are definitely on the downward slope. Now, these waves in many places, including the US and parts of the UK, have shown itself to run in sort of 2-month cycles. In other places like Brazil, it doesn't follow that. So it definitely looks as if it's going down, but it is without a doubt going to increase again. And it's driven by all these different variants that appear, and South Africa seems to be a variant factory, and people's behavior.
Doctor, how much of the decrease can be attributed to the vaccination drive? It seems that we are sort of getting somewhere. I do understand, and we've been told repeatedly, that we're quite far away from what's been termed the herd immunity. And on the back of that, Doctor, you would have recently heard that elections are going ahead as planned in this year, 2021, as opposed to next year, 2022, as had been recommended by the Maseneka report, the report which had specifically spoken about COVID-19 and the fact that we're in a pandemic and that we need to safeguard lives. I mean, you mentioned the fact that we mentioned the words utmost restraint, and it doesn't seem to me that, if people are going to be gathering in those large numbers to vote, to register, that we would then be, sort of caring for the fact that we need to give utmost restraint at this time.
I do share your concern about the election, not only the election day itself, but the preparations and the standard meetings that go about the political parties preparing for that. And it has all the hallmarks of being able to turn itself into a super spreader event. So add our particular situation on top of the fact that these variants and this virus comes up every now and then. I'm utterly convinced that by about November or December we're going to go into the fourth wave and subsequent waves until we manage to vaccinate a vast majority of the people, and I'm truly hoping that we would be able to do that.
Doctor, is there any other way that we can perhaps turn the tide in terms of what's, we're consistently hearing about this fourth wave that is to hit in December? And I suppose, my argument has been throughout that, I thought that the danger zone or the danger period would have been during the colder months, during the winter months. And, it's strange to hear that in September we could have this fourth wave that will really sort of bring us back to where we were.
In the colder months, people go indoors and they're much closer to one another than they are inside. But in the warmer months, we traditionally have many festivities over the December holiday,
Right.
when people come into contact with one another as well. So one way around or that way around, it gives a chance for the virus to jump. But I have some good news on research just out, is that vaccination not only reduces your risk of getting seriously ill and reduces your risk of getting ill at all, but it also cuts your risk of developing long COVID by 50%.
Yeah.
Which is another hopeful mark to say, please get yourself vaccinated.
Yeah. Doctor, in your view, is South Africa then on track with regards to its vaccination drive? No doubt we keep hearing government and we keep being told that people need to continue to go in their numbers. But if we are to look at the pace at which people are going at this time, are we perhaps on track or slowly getting there?
No, we are not on track. We've lost so much time. I think I'm not quite sure about the data change from day to day, but we still need to vaccinate about 18 million people in order to get to safe levels where we can return to some semblance of normality, always keeping in mind for the next number of years that we will have to wear masks and wash our hands and take precautions like that. Irritating, but at least affordable. But until we manage to get those 18 million people to the vaccination sites, we are going to be plagued by this. And to do that before the fourth wave strikes, we'll have to really motivate people to keep themselves safe, if not other people, by vaccinating.
All right, Dr. Jo Barnes, thank you very much for giving us your time here on SABC News. We appreciate it.
Pleasure.
All right, that is epidemiologist Dr. Jo Barnes from Stellenbosch University, talking to us about the impending fourth wave of infections on the backdrop of the upcoming local government elections, as of course we have heard that the elections will certainly go ahead 2021. Well,